Intacs corneal implants, a guide for patients with keratoconus. Intacs are two micro-thin corneal implants designed to treat myopia and astigmatism associated with keratoconus by reshaping the cornea to a flatter, more natural shape. Intacs corneal implants are smaller than a soft contact lens, but work within the cornea. In the nearsighted eye, the curve of the cornea is too steep. Light rays are bent too much and focus in front of the retina, making objects in the distance seem blurry. In the far-sighted eye, the curvature of the cornea is too flat. Light rays focus behind the retina, making close-up objects seem blurry. In the eye with astigmatism, light rays entering the eye through the cornea are focused at two different distances, causing distorted vision. In the keratoconus eye, the curvature of the cornea is like a combination of far, near, and astigmatic distortion, causing light rays entering the eye to focus at multiple points, producing visual distortions including halos, glare, and ghosting of images. In the normal eye, light rays entering the eye through the cornea are focused precisely on the retina, producing a clear image. Virtually all light that enters your eye passes through the central cornea to be focused. This central optical zone is crucial to clear vision. Intacs corneal implants do not remove tissue from the central optical zone, the area of the cornea most critical for clear vision. Intacs can be removed or replaced with a different size, providing flexibility for the future as eyesight changes naturally with age. Intacs are placed outside the central optical zone. Imagine a tent with a curved top, a shape similar to the curve of your cornea. If the sides of the tent are pushed out, the top of the tent flattens slightly. Placing Intacs in the periphery of the cornea flattens the cornea to a more spherical shape, allowing for images to come into focus more clearly. In the normal eye, contact lens tolerance may be restored, helping to achieve functional vision. The cornea of an eye with keratoconus bulges outward, creating a cone-like shape and distorted vision. Candidates for Intacs corneal implants are keratoconus patients who have experienced a progressive deterioration in their vision such that they can no longer achieve functional vision on a daily basis with their contact lenses or spectacles, are 21 years of age or older, have clear central corneas, have a corneal thickness of 450 microns or greater at the proposed incision site, have corneal transplantation as their only remaining option to improve their functional vision. In the past, the old treatment continuum has been that when patients are diagnosed with keratoconus or are suspect of developing keratoconus, they are fit with contact lenses or glasses. As keratoconus progresses, specialty contact lenses may be required to achieve functional vision. Once contact lens intolerance is determined or corneal scarring occurs, a corneal transplant is the next step. Today, with the new treatment continuum, patients who are told they have keratoconus or are suspect of developing keratoconus are also told about Intacs corneal implants. Once a patient cannot achieve functional vision with contact lenses or glasses, Intacs may be their best option. The ideal time for Intacs corneal implants is between contact lens intolerance and corneal scarring. The goal of Intacs is to achieve functional vision and potentially defer a corneal transplant. The Intacs procedure consists of a few steps. In the first step, a single small opening is made in the cornea. Anesthetic drops are used to numb the eye, which is held open throughout the procedure to prevent blinking. In the next step, the eye is prepared for Intacs placement. The eye is stabilized for 1 to 2 minutes. During this time, 2 semicircular tunnels are made in the cornea. The Intacs will be placed in these tunnels. The cornea has several layers, like a pad of paper. Making a place for the Intacs is like separating 2 pages just enough to create a space for the Intacs. In the final step, the Intacs corneal implants are placed. After the second Intacs corneal implant is placed, the small opening in the cornea is closed. Normalize your vision and maintain your future options with Intacs corneal implants for keratoconus. Intacs can be removed or exchanged, leaving your options open as future needs arise. Work with your doctor to develop the best plan for taking care of your vision care needs now and in the future.